السلام عليكم. إن شاء الله تكونوا جميعا بخير. أنا اسمي وائل الريس، أنا عضو هيئة تدريس في قسم إدارة والسياسات الأنظمة الصحية في كلية الصحة العامة في جامعة مركز الطب جامعة نبراسكا، ومدير سنتر في جلوبال هيلث اند ديفلوبمنت، ما اعرفش كلمة ايه دي بالعربي. آه، هو طبعا يعني انا مش هعيد الكلام اللي الدكتور ما قالته، بس طبعا اولا واخيرا لا ينسب الفضل الا لاهله. وانا لازم انسب الفضل للدكتوره مها، ان هي صراحه هي اللي يعني ستير هيدت المشروع دوت، وهي اللي كانت دايما بتزقنا الدكتوره انا عشان نخلصه يعني، فشاكرين مجهود. الموضوع بتاع الفيروس مانجمنت دوت، وفي ناس هنا طبعا انا عارف ان هم اخذوا تدريبات مع سنديه ومع غيرها في الموضوع دوت، لكن هو الصراحه احنا لما جينا نبص له، طبعا لما الدكتوره ما قالت الموضوع ده ما ابتداش الا من سنه واثنين، الموضوع ده ابتدى من 2018، وكان ليه يعني اسباب، وكان ضمن سياسه عامه اكبر خاصه بموضوعين، يعني التعبير بتاعهم او التعريف بتاعهم يعني بيتداخل. هو موضوع حاجه اسمها الهيلث سكيورتي، وحاجه اسمها البايو سيكيورتي، واحنا في كذا مشروع هنا في مصر عاملينهم. فده كان احد الروافد اللي هتسمع ان شاء الله على المدى القصير والطويل في الموضوع البايو سيكيورتي. فاحنا حبينا برضو كده ايه نديكوا سنس من الشغل اللي بيتم في مركز الطب جامعه نبراسكا. وهي يعني مش بادفوكيت للجامعه عندنا ولا حاجه، بس هي يمكن مستشفى وحيده او جامعه وحيده في امريكا كلها اللي عندها امكانيات على سبيل الحصر. وحاجه اسمها، واحده منهم اسمها البايو كونتينمنت يونت، واول واحده اتعملت في امريكا كلها كانت عندنا وما زالت اكبر. نمره اثنين حاجه اسمها ناشونال كوارنتين يونت، ولا يوجد في امريكا غير اللي عندنا. وبعدين في عندنا سنتر كبير اسمه جلوبال سنتر فور سكيورتي. فالنهارده انتقينا اثنين من الناس اللي شغالين في الثلاث حاجات دول، وهم ليهم خبره فريده، لان هم اصلا اشتركوا او كانوا ضمن التيم اللي تعامل مع حالات الايبولا اللي تم يعني استدعائها او جابوها لامريكا من افريقيا في 2014. وبعدين لما حصل طبعا في حاجات في النص لا داعي لذكرها، لكن برضه الموضوع بتاع الكوفيد لما ابتدى، اول مجموعه في امريكا كلها تيجي من الصين جات لنا احنا عندنا مستشفى، وهم كانوا من ضمن التيمز اللي اتعاملوا معانا. هم عندهم خبره فريده في هذا المجال، وبعدين طبعا شغالين بقى في الموضوع بتاع التدريب والاس او بيز والبروجرامز والكلام من ده. انا خليهم هم يبتدوا. اول واحده اسمها مورجان شرادر، وهي يعني واحده من الناس ذوي الخبرات القليله جدا يعني. اوكي you're good to go, good to go now, Morgan.
Good morning, Whale. Excellent. I hope everybody can see my slides.
We can see. Okay.
Excellent. Thank you so much. So thank you so much to Dr. El Reyes and the Planning Committee for giving me or providing me this opportunity to present on PPE considerations and the importance of education and training for pandemic responses. The objectives for today's presentation is really to describe the hierarchy of controls for healthcare setting safety, to really increase the knowledge on personal protective equipment and the components and the rationale for use for healthcare workers, and to reinforce the importance of training and education on personal protective equipment donning and doffing. So the hierarchy of controls was developed by the National Institute for Occupational Safety as a tool really to decrease injury and increase safety in all workplaces. This tool has been most recently applied over the last 3 decades to healthcare worker safety, to increase and to be used in developing processes to make sure that healthcare workers can carry out their tasks and jobs and be very safe in doing so. How we use the tool is really the most effective strategy for improving worker safety is at the top, and the least effective strategy is down at the bottom. And the irony of this is that PPE is most looked to in order to protect workers, but it's actually one of the more complicated tools that healthcare workers can use. So at the top, healthcare worker for elimination, teams should evaluate, can the hazard be removed? If it can't be removed, the next line of defense is, can it be substituted? Is there something that we can replace that would be safer? The engineering controls come into play is, if there is no substitute, can it be avoided? So can we change the way people work around the hazard? And the fourth control is developing workflows and policies and SOPs that workers can follow in order to make sure that their work is being carried out in a safe manner. And down at the bottom again is that personal protective equipment, which really has roles in all of the four strategies above, but it's placed down at the bottom as because it's one of the more complicated tools that we use. So here's a really brief situation of which the hierarchy of controls can be applied. For the situation, your team has been asked to assist with the refugee crisis, and there are several refugees that have lesions on their body and smallpox is suspected. So you want to identify the hazard. So the hazard in this situation is, the illness itself and the spread of the illness. When you move through all of the hierarchy of controls components, it really becomes, can you eliminate it? Well, if it is smallpox and you want to vaccinate for that, that's going to take time. But one of the tools that you could immediately apply is removing the sick individuals or the individuals that have lesions away from the other population by isolating them. For a substitution, there may not be a substitution for this in this scenario. So you have to kind of overlook that substitution component. For engineering controls, it's to identify the best location for an isolation area where there's low traffic. The healthcare workers can carry out their tasks without interacting with others within the healthcare area or within that setting. And you have to create isolation barriers. Those are all engineering controls to promote healthcare worker safety. From the administrative controls is implementing robust infection prevention control strategies and identifying medical countermeasures that can be applied. And it's beneficial to have those processes pre-identified for this situation response. And at the bottom is the use of the appropriate PPE. But it's the identification and the application of the PPE as the donning and doffing processes that really poses the greatest risk to healthcare workers. So with PPE being at the bottom of the hierarchy of controls, why do we use personal protective equipment? Well, personal protective equipment minimizes exposures to hazards. It also provides a barrier between the hazard and the worker when other controls can't reduce the risk down to susceptible levels. It also reduces the risk of injury and illness and spread from the healthcare worker to the community, to their family, and to other outside areas that when you're trying to control where that illness is. One of the essentials to PPE donning and doffing and PPE utilization is training, practice, competence, and observation in the uses and roles of personal protective equipment. PPE also has limitations. It does not protect what it does not cover. It also needs robust engineering and administrative controls on when to use it, how to use it, what setting to use it in. PPE does not address the hazard directly, so it's not going to eliminate that hazard, but it is going to add a layer of protection for the team members that are interacting with that hazard or somebody that has come into contact with that hazard. PPE does not guarantee the protection from the hazard, but if it is donned appropriately, donned meaning put it on, and if it is doffed appropriately, it does greatly reduce the spread of illness from healthcare workers to other members of the healthcare community. So prior to donning personal protective equipment, one of the key components of safe donning and safe doffing is to identify an area of which PPE can be removed where the hazard is not present. So if you are donning your personal protective equipment before going into a laboratory or before going into a patient care room, it's identifying where, when you're done with the task that you've been assigned to carry out, where you're going to doff that PPE at. It's also training and educating people on how to evaluate the PPE safety. So it's making sure that you look at all of your PPE components for any Manufacturer defects, any rips or tears. Is it fitting appropriately? What are the challenges that you're going to encounter when wearing this personal protective equipment? It's also identifying what PPE components can be safely reused if resource scarcity is present, meaning you don't have a lot of resources. So can you clean and disinfect face shields? Can you clean goggles if you're using those? If you're using a PAPR or a capper, can those components of those devices be cleaned and disinfected appropriately for reuse? And then there's always a plan and a need for proper disposal of the personal protective equipment, especially when you're interacting with, with a hazard. So one of the essential components is really identifying PPE levels. And this is a chart that was put together for 4 different levels of PPE. Level D has the lowest level of protection, and level A has the most complex level of protection. And with the PPE ensembles, there is the increased risk and complexity when donning and doffing PPE components, because if you don PPE inappropriately, doffing PPE becomes exponentially more challenging. So, apologize for that. So for a quick review, level D PPE is your work uniform. It's used for minimal protection, and it's really for nuisance contamination. It's scrubs or uniforms. You can add a face shield and gloves to this level of PPE component. So your gloves act as a barrier to protect contamination. This is all information that team members that should be educated and trained on when engaging in donning and doffing PPE. So gloves are not a substitute for performing great hand hygiene. It's something that is sometimes overlooked because they have a barrier between their hands and what they're interacting with. But hand hygiene should always be performed. Additionally, consideration should be given to wearing multiple layers of gloves if you're in an environment where glove changes and hand hygiene are going to be performed frequently. Procedure masks should also be educated on, and when you wear them, what is the role of a procedure mask and how to wear them properly. One of the most frequently seen errors in wearing a procedural mask is that people twist the ear loop and to provide a tighter fit, but it actually changes the dynamic of how the mask fits and creates gaps into reaching that individual's face. So understanding when procedure masks should be used and how to properly don and doff procedure masks when being worn. Level D components have pros and cons, and having healthcare workers understand in level D PPE ensembles, what are my pros for wearing this and what are my considerations or cons for wearing this. It does provide on a con the lowest level of respiratory and skin protection, but a pro is that it's minimal education is required for the healthcare worker in order to be able to carry out wearing that PPE ensemble. When escalating to a higher level of PPE, this becomes really where robust education and training for the healthcare workers needs to be, scheduled and maintained and continuously reinforced. As you add more components to PPE, the challenges come with how is that going to be doffed and removed when coming out of the environment of which we're using. So here's a side-by-side comparison of a higher level of PPE. One on the left, it's really considered COVID level PPE. This is what was worn throughout the COVID pandemic. And then the stage up is what we consider high level PPE, where it's more fluid impermeable. All of your boots covers are fluid impermeable. Your hood is fluid impermeable. And so then there's other considerations with that as well. As you notice, the N95 respirator was donned, but N95 respirators should actually be fit tested to healthcare workers on an annual basis. It's recommended because people's facial structures change. And as their facial structures change, the fitting of the mask does change. And so you want to make sure that healthcare workers are adequately trained on how to perform a seal check and identifying which mask should be worn for overall safety. We also need to educate healthcare workers on how to engage with team members when they're wearing their masks or they're interacting with their respiratory protection inappropriately. And so what are the key phrases from a safety perspective that they can use to address team members that maybe aren't wearing their personal protective equipment appropriately and how they should be, how they should address those considerations. Because to protect yourself, but have somebody else not doing the appropriate level of protection because they're interacting with their PPE components reduces the overall safety of that environment, because you have one in compliance and one in non-compliance. And so the impacts could be greater to the team and to the, to their families and to the community. You also need to provide information about PPE components as it relates to gowns. So there are multiple different levels of gowns that can be used, but also with gowns is where is the risk and where is the contact most frequent when you're donning a gown for performing of tasks or carrying out, carrying out studies or in the healthcare setting. So gowns are a great barrier to protect your clothing and your skin, but they also have low level of fluid impermeability to fluid impervious. And so being able to understand when level of gown should be worn, given what situation that you're in, is extremely important in developing PPE ensembles and PPE competency among healthcare workers. Your gown risks is something that isn't always considered, but should be taught to healthcare teams. Is where are you always going to be in contact, or where are you more than likely to be contaminated when donning a gown? And so your arms, when you're providing direct patient care, or typically a high level of contamination, and the front, if you're moving patients, if you're interacting with equipment, if you're performing lab tests, all of that contact to the machinery and to the equipment and to the healthcare space and to the patient care room is typically done in the front of your person versus on the backside. And so having that information and being mindful to train healthcare workers to make sure that they step away from the patient before turning their back. So that way nothing is contaminated on the back of their gown because they can't see that space. Utilizing face shields and goggles. And I saw APIC was a key member of components here, but it's also understanding that, use of goggles or glassware shouldn't be overlooked on using goggles, because glasses have an entry point to the eye on the side, and goggles provide that extra wraparound protection of their eyewear. And so making sure that we have that understanding of how to add additional layers to PPE components. And there's also, again, evaluating through from a team component, the importance of the pros and cons of enhancing high-level PPE and advancing to those PPE configurations. So the pros are there's really minor restrictions. They're more comfortable to use. PPE components are very familiar to team members. But the cons is that it does require robust education and training on how to properly don and doff PPE components. There is a need for fit testing and user seal check education on how to properly don masks. There is a potential for physical fatigue, which shouldn't be overlooked in areas of which, environmental controls, meaning keeping the area cool or warm, may be more challenging. And facial hair is always an impact on wearing any type of mask. And then you can advance to level C PPE, which is, really can be used when there are unknown or known contaminants in the air. But this is, again, a step up from the high level PPE, more complex donning and doffing, more layers, more components of PPE ensembles. So that has quite a few components to this PPE ensemble, of which then, education and training should be delivered to team members on overall components functionality and how to properly don and doff them. There are a large list of pros for wearing a level C PPE configuration, but there's also a decent amount of cons that should be considered when you are developing this. One of the biggest considerations for going to level C PPE is how do we adequately train and educate team members on the proper donning and doffing, and do we have all of the processes in place that can be used as a resource for healthcare workers to train? We also need to provide education about masks versus respirators versus powered air purifier respirators in order for team members and departments to really develop processes that provide the protection required, but also have critical components for education and training, storage, supply chain issues to be of that consideration. So with all of that education and training, we also have to, again, reinforce the failure points of personal protective equipment. And so if there is insufficient training plan or insufficient training occurring, PPE ensembles have increased rates of failure. If we don PPE inappropriately, to doff PPE becomes more complicated and the risk is greater. We've seen this over the 2014, 2015 Ebola outbreak, and again in COVID pandemic response with the inappropriate donning and doffing of PPE components, especially masks and respirators. If PPE doesn't fit correctly, it can increase your risk of exposures, whether it be through breaching the PPE, ripping the PPE accidentally through tasks, and then not having a process to get those individuals out of that environment very quickly and safely and efficiently moving forward. If we select the inappropriate PPE, it also reduces the protection in that environment. And so making sure that team members understand what the PPE does, what its limitations are, and kind of going forward with identifying how to properly don and doff, whether that be through SOP development or standard process development. When you're doing these tasks, I wear this PPE, but it does require education and training. Using visual recognition for proper donning doffing is one tool that I just wanted to highlight that can be utilized for overall healthcare just-in-time resource use or just-in-time training, if that were to arise. So the key takeaways for the importance of training are education and training reduces the likelihood of improper use of PPE, but it also provides an environment of which rationales and components can be described and discussed for general information, but also to use to educate other healthcare workers in various settings. To familiarize healthcare workers with PPE can reduce the limitations of PPE selection by understanding, if I use this component, this is my consideration, but if I use this, I have broader coverage of that. It can reduce the errors in selection. It can enhance your readiness and resiliency for pandemic response, knowing that healthcare workers have a general knowledge of PPE components. There's SOPs that have been developed or processes that are developed for donning and doffing. And it also can reduce the workplace exposure to blood and bodily fluids, which protects the individual healthcare worker, the team that the healthcare worker works within, and also the community at large, their families, because they're being safer at work by providing barriers between healthcare workers and in the tasks that they're performing. Happy to answer any questions that anybody may have.
Hello, can you hear me?
I can hear you.
Thank you for this important presentation. I want to ask a question, please. You mentioned the lava. Is there any scientific evidence that lava is more protected than in the
Dr. El Reyes, could you tell me again? There was a lot of feedback on that.
She was asking دكتور بعد اذنك تعالى هنا نعيد عليها السؤال هنا بس.
Hello, Morgan. Do you hear me?
I can hear you.
Yes. I ask about if there is any scientific evidence that double gloving is more protective than the single gloving.
I'm not sure if there is any published studies on that I could speak to right off the top of my head. But there is, I think, validation in processes of which we use the second pair, which is the first pair of gloves, actually taped to our gowns to represent our hands, because healthcare worker compliance on performing proper hand hygiene is less optimal than what we would like it to be, just from education and training. And Beth might have information on that as well. I see you're popped on.
Thank you.
Yeah, I think there's a practical reason we do it from the standpoint of having that additional layer as you're doing things like donning and doffing. If you think about peeling off dirtier layers and getting down to cleaner layers, but as far as it truly being more protective, it's probably hard to justify that, but it does obviously provide additional thickness. So.
No, agreed.
Thanks, Beth.
Mm-hmm.
A small question to Morgan, please. We know the Qatar, which is a powered air purifying respirator. Can you clarify what is the difference between Qatar and Qatar, please?
That's actually, I'm glad that's on. The capper I'm not as familiar with as I am with the papper. We wear pappers here on campus at the Nebraska Medicine, but cappers are also utilized across. They're just a different component and a different system setup. Beth, can you highlight that?
Yeah, it's kind of something that annoys me. It's actually a brand name. CAPR is a brand name. They all meet the criteria from CDC and NIOSH as being a powered air purifying respirator. They just annoyingly named it really similar. So,
which is frustrating.
Yeah, it is, because it's like tissue and Kleenex. It confuses people. And so
that's a good one. I like that. That's a good one.
It confuses people and makes people think it's a wholly different product. And truly it really is just another powered air purifying respirator that's loose fitting. So, it's nice to see all of you. Cool.
Excellent.
Okay. Thanks a lot, Morgan.
Thank you, Whale. Thanks, Beth.
Thank you, Morgan.
Take care.